Well, Dee White joins us today. She is a nurse practitioner with the Peripheral Vascular Institute at Arkansas Heart Hospital, and she's here to explain a little bit more about what they do, because this is part of Arkansas Heart Hospital, right?
It is,
yeah.
It is.
But what is PVI? It's right there on your jacket.
Well, PVI stands for the Peripheral Vascular Institute, which is a specialty department within the Arkansas Heart Hospital, and we deal with vascular disease or circulatory problems outside the heart, primarily in the legs, but you can also have vascular disease in the carotids and other vessels in the body.
Okay, so that's called PVD when it's down in your legs or feet or other extremities.
PVD, PAD, sometimes is some of the newer terminology that we'll see, peripheral arterial disease.
So is it plaque in these veins just like we hear about in the heart?
It is. There are two types of vascular disease that we see at the Peripheral Vascular Institute. One is the plaque, which is the obstruction of the blood flow once it leaves the heart down to the extremities. If you can't get blood flow, the muscles can't get oxygen, and therefore you get the leg pain, fatigue, weakness when people try to walk. That's usually what they notice. Their legs just don't want to go. The second part of what we do is the return flow back up, and that's venous insufficiency, and that's more of a mechanical issue when the blood doesn't circulate back up and it tends to pool in the legs, and that tends to be more of the heaviness, sore, achy legs, swelling, that kind of thing.
Okay, you mentioned some of the symptoms there, and we've got them on the screen. You mentioned the leg pain, tired legs, wounds that sometimes won't heal is also a symptom.
Absolutely, and again it comes back to the flow of oxygen to the tissue, which is necessary for wound healing, and also on the other side, on the venous side, you can have venous wounds as well, and that pooling and that pressure and all of the swelling then tends to slow down that healing process.
We don't know the exact cause, but you said we know the people who are more susceptible, and usually they have certain diseases.
Absolutely. Folks who have diabetes, who are smokers, high cholesterol, high blood pressure, and of course existing coronary artery disease. If you have a blockage, so we call it, in the heart, then you can expect to have that in other vessels because it is the same disease process, the same plaque.
It's very similar to heart disease.
Absolutely.
Yeah, so you're watching those patients.
We do. In fact, what we like to do is we say, please get your legs checked if there's any question, because then we'll turn around and look in other areas. And of course, this is heart attack and stroke. Legs are bad enough, but heart attack and stroke, of course, we know the severity.
And then treatment options if you do have PVD.
Yes. First thing you have to do is you got to get checked. Okay, and that's the main thing. The earlier that we know about the problem, the easier it is to fix. We call it a window of opportunity that we have there. But certainly all the things that you would think about for heart healthy, diet, exercise, of course medications controlling your diabetes, and then there are more invasive, once the disease process is there, Melinda, we can look at things like balloons and stents. A lot of patients call it Rotorooter, where we go in non-surgically and clean out the arteries. And then of course in the more severe cases we can do bypass surgery to restore that blood flow so that folks can get back to function.
I heard my dad say that so many times, Rotorooter.
Absolutely.
Let's talk about the main goal of your clinic.
Well, the main goal is really to get that window of opportunity. Amputation is our enemy, and even in 2015, amputation is a reality for a lot of folks. So what we hope to do is stay a step ahead of that and prevent amputation. And of course then in the lesser severe, we like to give people their function back. This time of year you want to be in the yard, you want to be in the garden, doing the things that you enjoy, and if your legs don't want to take you there, it's really, you lose function.
How does a patient usually get to you? Is it through their primary care physician, or have they had some heart issues, a cardiologist?
Both. We see patients who come in on referral from their primary care because the primary recognizes there's a problem. We have existing patients internally who have been patients at the heart hospital with our cardiologist that we know if we find it in one area, we're going to look elsewhere. And then we have self-referral, because other than insurance requirements, we don't require any referrals to come into our clinic and have an evaluation.
So if you have some of these symptoms, legs are suddenly tired when they shouldn't be, I guess, you know, then you should come in and get checked. And then what about, are there any kind of precautions, like if we use our legs more, if we're more active, does that seem to help?
Well, activity is important. You know, walking is the single best medication that we can prescribe, you know, and certainly keeping that blood flow. People who have venous disease tend to be folks that are on their feet a lot, you know, so taking those breaks, putting your feet up when you can, you know, those kind of things. But it's really just a heart healthy and just a healthy lifestyle is the best prevention. And with genetics, you know, there's not a lot we can do about that. So again, come back to early detection.
Absolutely. And if you do have that in your family history, that needs needs to be checked as well.
Absolutely.
One important reason. Okay, great information from Arkansas Heart Hospital. We have them on quite often, but I don't think we've talked about, you know, the legs and feet, and that's all part of it with Peripheral Vascular Institute. There's the information on your screen. It is part of the Heart Hospital, so you can reach them at 978-3746. Miss D, thank you.
Thank you.
Appreciate your good work.
You bet.
Okay, back in just a moment. We're going to check on your weather forecast right after this.